Welcome to our second module of the Champions Education series, where we will now focus on hand hygiene. The objectives for this presentation will include being able to describe hand hygiene best practices, identify the transmission, methods, and moments of hand hygiene, demonstrate proper hand hygiene procedures while recognizing common hand hygiene impediments, understand hand hygiene audits and audit tools, and apply and share this knowledge and these practices within your setting. Before we dive in, it's important to be aware of the hand hygiene best practice document created by Public Health Ontario. This document provides direction and scientific reasoning for the optimal performance of hand hygiene. It includes different methods and provides reasoning on when to utilize them, discusses the advantages and disadvantages of different hand hygiene agents, and discusses both barriers and enablers that might influence hand hygiene. In addition to the best practice document, which everyone should review, we have included some other helpful resources as well as their QR codes so you can access them easily. Go ahead and pause this slide or come back to it later if you would like to explore these resources. Keep in mind, World Hand Hygiene Day is May 5th if you are wanting to plan something fun for your facility surrounding hand hygiene education. Now let's get into hand hygiene and transmission. Hand hygiene and transmission go hand in hand, pun intended. When it comes to the transmission of microorganisms, our hands, and particularly the hands of healthcare providers, are the most common vehicle for transmission. Within congregate and other care settings, this transmission can occur from client to client to equipment and/or environment, and from environment and equipment to the client. Care providers assist multiple clients throughout their day in various situations and tasks. For this reason, staff can be the link of transmission between individuals, increasing risk of infection from one client to the next. Providers also use shared equipment and environments, such as rooms, and can transfer microbes from the client onto these items and surfaces. Vice versa, the provider could also transfer the microbes from the equipment and the environment onto the client. During the delivery of any direct care, the provider's hands continuously touch surfaces and substances, including inanimate objects, client's intact or non-intact skin, mucous membranes, food, waste, body fluids, and the provider's own body. Without proper hand hygiene, the risk of transmission of an infectious organism is extremely high. By performing hand hygiene, we are able to break a link in the chain of transmission to stop any potential spread. The total number of hand exposures in a healthcare facility might reach as many as several tens of thousands per day. With each hand-to-surface exposure, a bidirectional exchange of microorganisms between hands and the touched object can lead to the spread of microorganisms throughout a healthcare environment within just a few hours. Although some of the language in this document and presentation speaks to healthcare facilities, it is also applicable to congregate care facilities, which are still providing many of the same procedures, such as long-term care or higher needs group homes. However, in addition to health services, congregate care facilities also offer activities, recreations, and a variety of food services to their clients. All of this could still result in thousands of exposures. Caring for clients can also be very hands-on. During an average day, a healthcare worker or other staff may perform multiple tasks, including direct client care. A seemingly simple task, such as helping someone to get comfortable in bed, can result in thousands of organisms being transferred onto and from a healthcare worker or staff's hands. Other tasks, such as taking a pulse or blood pressure, can result in an equally large transfer of organisms. Remember, as we go through this module, hand hygiene is the responsibility of all individuals involved in healthcare and congregate settings, not just those who perform direct or medical care. Let's take a quick look at a video on transmission. Although this shows an example of a doctor and a patient, the idea is the same applied to any setting and highlights the different ways transmission can occur.
So, we have been talking about hand hygiene, but really, what is it? Hand hygiene is a general term referring to any action of hand cleaning. Hand hygiene relates to the removal of visible soil and removal or killing of microorganisms on the hands while maintaining good skin integrity. People are naturally complacent about everything in life, and that's just natural. We all know we have to wash our hands and that certain moments we should do it. But don't we also all know the speed limit when driving? However, almost everyone will drive over the speed limit, even knowing that that could put themselves at risk or others. That's why we have speed limit signs posted along our roads and why we have officers to enforce these speed limits. Humans need reminders. Same goes for hand hygiene. This is why it is important to talk about hand hygiene, relearn it, practice it, have signage, and our own type of enforcement around it. Hand hygiene is something so simple and easy, yet it can prevent illness, thus saving lives. Effective hand hygiene kills or removes transient bacteria on the skin and maintains good hand health. So, how do we achieve this? There are two methods of killing or removing microorganisms on the hands. The first is hand sanitizing with a 70 to 90% alcohol based hand rub, also referred to as ABHR. This is the preferred method for cleaning hands when they are not visibly soiled. Using easy, accessible, alcohol based hand rub takes less time than the traditional hand washing and has been shown to be more effective than washing with soap and water when hands are not visibly soiled. The effectiveness of alcohol is inhibited by the presence of any organic material, meaning dirt, grime, or that visible soilage on your hands. The second method of hand hygiene is hand washing with soap and running water, which must be performed when hands are visibly soiled or feel soiled. The mechanical action of washing, rinsing, and drying is the most important contributor to the removal of those bacteria that might be present. So, what if running water is not available and my hands are visibly soiled and dirty? You want to use a moistened wipe to remove that visible organic material. This provides that mechanical action and some detergent to help remove any of the soilage off your hands. Then you can follow up with alcohol-based hand rub. So any little germs that can be left behind after your hand washing technique with the moistened toilet can be killed or deactivated. You might run into this when you're at a park with a client or outside with a client or maybe perhaps in a vehicle with a client. So let's chat quickly about alcohol based hand rub or ABHR, or sometimes also called hand sanitizing. Your hands have visible sticky If your hands have visible or sticky with dirts and substances on them and you try to use ABHR, then you just end up sanitizing that surface dirt and kind of moving that dirt and grime around on your hands. So you're not actually removing that dirt or substance that could have those harmful microbes hiding behind them or around them or still on your hands. So your hands can't be visibly soiled. We can't stress that enough. Or you can't feel it. So it may not be visible, but you can feel that they're sticky. That means there's something on there that you need to get off first. So 1 to 2 pumps is usually good depending on the size of your hands. The larger the hands, the more surface area there is that needs to be covered. So you might require 2 pumps if you have large hands, or if you have average to small hands, you might just need 1 pump. You should be able to rub your hands for that full 15 to 20 seconds with product before they come dry. So if they are dry after 10 seconds, then you didn't have enough, and you're going to have to remember that you need a little bit more, maybe that extra pump. You need to follow the same sequence of rubbing your hands as you do to lather soap. So that ensures you get all areas, and you can see that here on how to hand rub on the poster on the screen. The recommendation of that 70 to 90% alcohol content is important. You don't want the product to be above 90. A lot of times you can find 99%, as the product will evaporate too quickly on your hands for it to actually kill anything there. Anything below, so you sometimes they might sell something around 60%, is not going to be as effective as removing and killing those microorganisms. We have also had questions pop out about the use of non alcohol based hand rub. Now, this is not recommended for use in our health or congregate settings, but we do understand that alcohol based can be a trigger or a concern for some clients. So in these situations, we recommend that you have individual alcohol-based hand rubs on yourself, the provider. So maybe it's in a pocket or a lanyard, or perhaps it's in an office where you can access it when you need to. Otherwise, just having those extra hand washing prompts. So if it's signage or maybe bringing in a temporary sink or designating a specific hand sink for that hand washing. Next, we're going to play a short video of the proper way to use alcohol-based hand rub. A video supplied on YouTube by Public Health Ontario.
Check that your hands are visibly clean. If there is obvious soiling, follow the steps for hand washing. Apply 1 to 2 pumps of product to the palms of your dry hand. Rub your hands together, palm to palm. Rub in between and around your fingers. Rub the back of each hand with the palm of your other hand. Rub the fingertips of each hand in your opposite palm. Rub each thumb clasped in the opposite hand. Rub your hands until the product is dry. This will take a minimum of 15 seconds if sufficient product has been used.
Okay, now let's do a concept check. Let's test our knowledge. True or false? Alcohol based hand rub, or ABHR, is the preferred method for cleaning when hands are not visibly soiled. We'll go over the answer on the next slide, but if you need a couple more seconds or minutes, you can always pause the slide here. This is true. So again, when they're not visibly soiled, when you can feel any stickiness on them or you can see the dirt and grime, then you need to perform hand washing. What is the recommended percentage of alcohol required for effective alcohol-based hand hygiene? A, 10 to 30%, B, 30 to 50%, C, 50 to 70%, or D, 70 to 90%. Again, if you need another moment, you can pause it here. Otherwise, we'll go over it. The answer is D. 70 to 90% is the recommended percentage required. Remember, anything too little won't have enough to kill, and anything too much will evaporate, so it doesn't have that time to work effectively against those microbes.
Here we have our steps of proper hand washing. Wet hands with warm water. Apply soap. Lather hands for 15 seconds, taking care to rub between fingers, fingertips, backs of hands, thumbs, and palms. Rinse hands under running water. Pat hands dry with paper towel. Turn off water using that paper towel. Warm water is important to activate the soap to create the lather that picks up and traps the dirt that is then rinsed off. Warm water also promotes the required length of hand washing time, 15 to 20 seconds. Drying can't be skipped. Hands need to be dried using a single-use towel to help remove the microbes, which is the ideal method. The use of air dryers is not ideal in congregate living settings as they can spread aerosolized bacteria throughout the facility, which can then be transmitted to clients or staff members. We will now watch a video on the proper way to wash your hands.
Wet your hands with warm water. Do not use water that is too hot or too cold, as it is hard on your skin and will lead to dryness. Apply liquid or foam soap. Lather the soap and rub your hands palm to palm. In healthcare settings, bar soap should not be used for hand washing because it is easily contaminated. Rub in between and around your fingers. Rub the back of each hand with the palm of your other hand. Rub the fingertips of each hand in your opposite palm. Rub each thumb clasped in your opposite hand. After a minimum of 15 seconds, rinse your hands thoroughly under running water. Be sure that all soap is removed, as soap will dry your skin. Pat your hands dry with paper towel. Rubbing with paper towels can damage your skin. Turn off water using a paper towel to avoid recontaminating your hands. Dispose of the paper towel into a waste container.
So we have discussed transmission, how to perform hand hygiene, and what we need to perform it, but when do we perform hand hygiene? This can be referred to as the moments of hand hygiene. Recall that transmission can occur by contaminated hands of employees. The purpose of these 4 moments are to break the chain of transmission via this route. In healthcare, we talk a lot about the 4 moments of hand hygiene, which are directly related to the client and their environment. The 4 moments of hand hygiene include before touching a patient or their environment, before a clean or aseptic procedure, after a bodily fluid exposure, and after touching a patient or their environment. In addition to these 4 moments of hand hygiene, best practice would also be to clean your hands before preparing, serving, or handling any food, before taking your break, before touching clean PPE or donning clean PPE, or before using a shared device such as a computer or desk area. Additional moments after for hand hygiene include after preparing or handling food, after having your break, after using the washroom or assisting clients with toileting, after taking off your dirty PPE, using a shared device, or after touching garbage. These moments have been drilled into regulated health professional studies and practice. These moments can also apply to staff within congregate settings, even though they can look a little bit different depending on the types of roles and responsibilities of employees. Remember that at any time, if you feel your hands are or have become dirty or contaminated, hand hygiene is key. It is not limited to only the moments discussed on the previous slides. Hand hygiene is only as good as the user. If you use alcohol-based hand rub and only use a small amount that dries within 5 seconds, then you are not successfully killing all of the disease-causing microorganisms that will still be found on your hands. It takes the recommended 15 to 20 seconds in order to wash all areas of your hands. Do it once and do it right, and in the end, it will save you time and consequences. The areas that are commonly missed when performing hand hygiene include the wrists, the thumbs, and in between the fingers. Alcohol-based hand rub can be more effective as it is less reliant on factors like warmth of the water. It is also less time-consuming for the person performing hand hygiene and easier to remember to do when there are lots of hand hygiene stations set up at a workplace. Now it is time for a concept check where we test your knowledge on the previous slides. The question here is, if you are only entering a client's room to help them adjust their pillow, you need to wash your hands. Is this true or false? So in this situation, the answer is true, because anytime an employee or another healthcare provider interacts with a client or their immediate environment, they must perform hand hygiene according to the 4 moments of hand hygiene. Now that we've discussed what effective hand hygiene looks like, let's review 3 things that make hand hygiene less effective. Many healthcare facilities, especially hospitals, have strict no nail polish policies in place for those who provide direct care to clients. This may be something that could be adapted by your facility. This doesn't typically apply to all staff, such as those in office or administrative roles, but it could apply to kitchen staff or staff that provide care to clients, for example. Chipped nail polish or nail polish worn longer than 4 days can harbor microorganisms that are not removed by hand washing, even with surgical hand scrubs. Fingernail polish, if worn, must be fresh and in good condition with no chips or cracks. Gel polish has been shown to damage nails, resulting in nail weakness, brittleness, and thinning, putting nails at an increased risk for breaking. Nail art, such as adding decorative paint effects to nails or gems, has been shown to be associated with outbreaks of infection in healthcare facilities. In a study conducted in a hospital, it was noted that surgical site infections and hemodialysis-related bacteria have been linked to artificial nails. It is important to also have reference to this in your facility as a procedure or policy for staff who provide direct care or handle food within the environment. In terms of jewelry as an impediment to effective hand hygiene, rings will hide dirt and microbes around them. Mounted stones on rings will easily rip gloves, which is an issue, especially while working with bodily fluids. Silicone rings that can be easily removed and washed have become increasingly popular with those working in healthcare, the food industry, or with machinery. A single, simple metal band is also appropriate in this situation. These rings are easier to clean and ideal for those working in these settings. If you wear a watch, wear it higher up on your wrist than usual to ensure that hand hygiene can be completed properly.
There are many different approaches to improving hand hygiene compliance, but the introduction of a hand hygiene program within an organization has been proven to be one of the most effective ways. So, what makes a hand hygiene program effective? An effective hand hygiene program is based on using the right products in the right place at the right time by care providers who have received education in the appropriate hand hygiene indications and techniques. It is also combined with a good hand care program. In addition to this, an integral part of an effective hand hygiene program is the promotion of hand hygiene by champions and role models within their care setting. By being role models for best practices, champions take a personal responsibility and hold others accountable as part of their facility's internal responsibility system. A hand hygiene program has to include many working parts or components in order to be effective. You need buy-in and support from leadership to implement policies and procedures. It requires ongoing monitoring of compliance, performance indicators and feedback to care providers. It requires client, family, and visitor engagement through education. The champions and role models are the opinion leaders, and they model the right behavior. Staff education and awareness includes ways to motivate, educate, and train. The environmental changes and system supports encompasses user input in key elements such as product selection and placement, point of care alcohol based hand rub, and freestanding hand washing sinks. Lastly, it requires a way to continually monitor, evaluate, and improve practices within your organization. So, to break the components down a little further, we are going to chat about a few of these specifically, starting with policies and procedures. For each care setting, a written hand hygiene policy and procedure must be developed that includes the following: indications for hand hygiene, how to perform hand hygiene, the selection of products used, appropriate placement of hand hygiene products, management of product dispensing containers, a hand care program, use of alcohol based hand rub as the preferred method of hand hygiene, issues pertaining to nail enhancements and jewelry, and lastly, hand hygiene compliance and feedback. The next component of a hand hygiene program that is important but often overlooked is hand care. The condition of the hands can influence the effectiveness of hand hygiene. Paying careful attention to hand care is an essential part of the hand hygiene program. Intact skin is the body's first line of defense against bacteria. Dermatitis, cracks, cuts, or abrasions can trap bacteria and compromise hand hygiene. Staff should be provided with hand moisturizing skin care products and be encouraged to regularly use them to minimize the occurrence of irritant contact dermatitis associated with hand hygiene. As we have touched on already, alcohol based hand rub is preferred over hand washing because hand washing can lead to dry, cracked hands. Alcohol based hand rub has additives that will lock moisture into your hands and keep them smooth. Dry hands are also exacerbated by hand washing. Ensure to moisturize, especially before bed, to protect the integrity of your hands. We've touched on some ways to protect your hands by moisturizing and the impact the condition of your hands can have in a care environment. But what are some ways you can reduce skin dryness and irritation with all the hand hygiene you'll be doing? You can use warm water instead of hot water. Rinse thoroughly and pat your hands dry with a paper towel instead of rubbing them. Frequently use the lotion that is provided by the facility. And protect your hands 24/7 from chemicals and extreme conditions at home and work. Lastly, I want to touch on the education piece of a hand hygiene program. All in all, when you as champions participate in this training session, you are receiving education on all things hand hygiene. This knowledge should also be implemented and incorporated within your care settings for all staff and residents in order to be effective. The hope is for us to be a resource for you to educate within your own facilities. When providing education to staff and residents on hand hygiene, it should include information on the indications for hand hygiene, factors that adversely influence hand hygiene, hand hygiene agents, techniques, and hand care to promote skin integrity. All healthcare providers should receive basic training and periodic retraining to reinforce their practice. We will now be watching a video about why clean hands count. These are just some resources that can be helpful when looking for evidence-based information and tools to implement within your facility.
Hand hygiene performance can be monitored directly or indirectly. To evaluate hand hygiene compliance within your organization, you most likely are implementing both methods, however, we don't realize it. Direct methods include direct observation or auditing using a tool, and indirect methods include monitoring the consumption or use of products, such as soap or hand rub, which is also important to do. For example, you fill a soap dispenser at the hand sink within the kitchen, then you note the date the dispenser was filled and go back frequently to monitor its use. Now let's discuss auditing. What exactly is it? Auditing is the process of making sure that techniques being practiced within your setting follow best practices set out, which in this case is hand hygiene technique, and is done through direct observation of staff. It is a snapshot of practices across all staff. Keep in mind, like was mentioned in the previous slide, that you are also monitoring those resources that are needed to ensure proper hand hygiene can take place, such as hand hygiene products, whether alcohol-based hand rub or liquid soap, placement of products, quality of the product, and user frequency. Now that we know what auditing is, let's look at why we audit. There are many reasons why we conduct audits. At the end of the day, observation and measurement is a vital part of the quality improvement process. You must complete audits to determine a baseline of compliance. If a facility has not completed auditing or it's been some time since auditing has been performed, the first step is to get out there to see what is happening within your setting and what the current compliance rate is. This will set your facility's baseline. Once your baseline is set, you need to review or set your organization's hand hygiene compliance goal. Every organization should have a hand hygiene compliance goal, and believe it or not, it's not 100%. This is because that would be unrealistic, unachievable, and will just lead to frustration and failure. If your organization does not have a goal, work with key players to set an achievable one. Say if the baseline is 45%, set your goal to 70 or 80%. Or if the baseline is 70%, then set your goal to 90. As you continue to audit, you are setting a benchmark for improvement. Compliance rates allow us to better understand where areas for improvement lie and where more education is needed to reach your organizational goals. Also, it allows you to see where good practices are being upheld and by who. So as we move forward and complete audits, you can monitor compliance rates and continue to work to improve hand hygiene compliance within your setting. Next, when should we audit? Auditing should be completed when you need to determine or set your facility's compliance baseline. If you are new to the facility, you will want to audit so you can get familiar with the layout, staff, and current practices. Also, whether or not there is a large staff turnover. If there is a staff turnover, you will need to establish a new baseline, so perhaps every day for a week, or 3 times a week for a month as an example. You would want to audit when client care increases or drastically changes within a home, because this may indicate that more products or dispensers are required. A large facility with numerous staff may have to audit more often to capture the whole picture, which includes any staff turnover and multiple units or levels that may be staffed 24 hours a day. Intermittently auditing ensures the same people aren't continuously being captured and provides a better spectrum of coverage. And lastly, who should we audit? When we're looking at who, we should be directed to all staff from all areas. We shouldn't concentrate solely on nurses or support workers or just on one particular floor. We should also include administrative staff and supervisors who may be entering the floor or unit being observed. During an outbreak, an increase of auditing is asked as there is an increase in staffing and an increase in hand hygiene levels due to the increased care and use of PPE. Successful auditing involves acknowledging that there are many barriers beyond the individual's control that can affect compliance. For example, the alcohol-based hand rub dispenser is missing or not available where needed, the dispenser is empty, or it's discovered a soap dispenser at the hand sink is broken with no paper towel to dry your hands. During the auditing process, it's important to engage with staff, encourage a judgment and blame-free environment where they are able to identify areas of improvement, and share without fear of punishment. In speaking with staff, you may come to realize that a particular staff member has already asked management, environmental services, or possibly another staff to fill the empty dispenser, and yet it hasn't been completed. In this scenario, encourage collaboration across disciplines to identify unsafe practices and seek and facilitate resolutions to the problems identified. When it comes to observing noncompliance, do you act and provide feedback, or do you just observe? Use a combination within your setting. Depending on why you are auditing, you may not want to intervene. For example, if you are setting your baseline, you want to just observe and collect the data. However, if you are auditing to gauge compliance so you can target education, you will want to intervene and provide feedback. Of course, you must intervene if what you are observing is detrimental to the health and safety of the staff or clients. If you are choosing to intervene, it's all about your approach. You want to be kind, ask the staff member to step aside somewhere private, and provide the feedback necessary to correct the noncompliance. You do not want to berate or belittle a colleague. Your approach should be non-threatening, timely, and specific. Explaining the reasoning to the observed staff goes a long way as well. Individuals want the rationale behind why you are asking them to do something. Something else that is beneficial is to share the results of the audit with staff, as this helps to promote improvements within best practices. You also want to promote a culture of a safe and healthy workplace. Respect and maintain confidentiality, and never disclose personal information or identifying factors. These are some hand hygiene audits and observation tools available for you to use through Public Health Ontario's website. Some questions to consider: how many of you are familiar with the PHO audit tool, and how many facilities utilize their own? Here is another example. Go ahead and pause and follow the QR codes if you would like to access them.
In addition to hand hygiene programs within your organization, what are some ways you can increase compliance and resist complacency when it comes to hand hygiene? Well, posters and signage are good in the moment reminders. Change them up so they are new if they already exist, or slightly change the location. Find new locations as well. Our facilities designs change, and sometimes signage is forgotten or needs to move. Remember, signage works best if it's bright, concise, and at eye level. Use training videos on hand hygiene, such as the public health ones that you watched earlier. If there's a TV or monitor where they can be played on a loop in a common area or break room, this is a great opportunity as well. Or perhaps have staff sign off if they've completed watching it. You could even make this into a contest. First 50 to complete gets the name entered in for a draw, or other things too. Another activity to increase compliance is to promote education. Feel free to speak to us at the IPAC Hub if you want a hand hygiene presentation or on site activities. This is something we could provide or do in conjunction with you to help raise awareness, understanding, and compliance. The health unit does have some glow germ kits that you can be rented that we can bring on site for you to utilize. So these are the glow germ kits, and that's where you put fake germs on your hands with a specific solution that is UV reactive. You practice washing your hands, and then the glow light will show the areas that were missed during hand washing by illuminating or glowing those germs. Next, we'll watch a video showing that. We are now going to watch a video of how to properly use a glow germ kit. So first you want to do is take the glow germ solution and rub it all over your hands. So then when you take the UV light to it, you're going to see that solution of germs is left all over your hands. And there's quite a bit there, as you can see. Next, you're going to want to wash your hands properly, or as you would, with soap and warm running water for at least the 20 seconds. Again, trying to concentrate on all areas you're supposed to remove the germs. Once you're done washing your hands, you're going to want to use paper towel to dry off your hands and to turn off the faucets because you use those germy, dirty hands to turn the faucets on. Unless you have a hands-free sink, then you're good to go. After you're done drying off your hands, you're going to take the UV light out again or place your hands in the UV light tray and to see where, if any, germs are left. If you've done a really good job, there should be no more germs or glowing things left on your hands. And this really helps you see areas that you might miss otherwise. Thank you. So you don't have to invent the wheel when it comes to hand hygiene or IPAC activities. There are already many created out there with easy steps for you to follow. So here are some three great resources that contain many different types and levels of IPAC activities. The pictures are actually of some hand hygiene activities that the IPAC Hub did here with our health unit staff for National Infection Control Week. And that's when we highlighted hand hygiene. Activities don't have to be difficult, they can be simple, yet still very effective. So you see here, we have some QR codes for you for each of these. So you can link to those websites, which have a plethora of information and things for you to use. Okay, since you're becoming IPAC champion and hand hygiene is number one in IPAC, we want to challenge you to do some homework. Part of becoming a champion is being comfortable in your role and being a leader. We do have three challenges for you after this module. The first challenge is we'd like you to pick one of the hand hygiene audit tools that we went over in this module and utilize it in an area of your facility or program. Our second challenge for you to help you become an IPAC champion is to complete 5 hand hygiene observations. These all don't have to be done at once or the same day. We remember and recall we all have different congregate living settings and they're very unique. We just want you to be exposed to these and know what it feels like and means to do one and have a little bit of experience. Sometimes we have to get uncomfortable before we get comfortable, especially with something new. Our third challenge is for you to set up a hand hygiene activity or promotion within your facility. Recall all the already made and available to you resources. You can even go back to that slide and utilize those QR codes now for those direct links so you can pick one out super simple. Remember, this doesn't have to take a lot of time or resources. And lastly, we want you to reflect on your activities. How did they make you feel? What went well? What could you improve on? We would love to hear from you and how these went. So feel free to email some pictures or results from your challenges. You can do that either all at once or one at a time. And we can also help you reflect and strengthen as an IPAC champion based on those. So our email is on the slide, so please feel free to use it and contact us anytime. And with that, that brings us to the end of Module 2 in the 5-part series. You can go back to the website and continue on to Module 3 when you're ready. Thank you.